Hello, 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 everyone. It's Dr. Tamara Beckford, and welcome to the Dr. Tamara Beckford Show. I am excited to bring in one of my sister doc. I love, love, love this lady. I've met her a couple times in person. We are connected like every week on social media and also talking, and she is really going to give us some great insights. She's really, really a wonderful doc. Today, we're going to be talking about Beyond the Scale. Now, it is almost time for the holidays, and so many people are worried about what's going on, about even just trying to transform their health and their weight, which is part of, health, right? So we're going to talk about how to transform that mindset of yours for weight loss. So today we're talking about Beyond the Scale, how to transform your mindset for weight loss. So this wonderful doc, let me bring her in so we can get started, because I know a lot of us are like, yes, please, 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 please help me with this. All right. So she's a graduate of the Creighton University Medical School, and she did her residency at the University of Chicago in family medicine. As most of my docs, she didn't stop there. She went ahead and she is now a diplomat of American Board of Obesity Medicine. So not only did she get her training in family medicine, she got extra training in obesity medicine. She also runs her own private practice. It's called the Sarah Stombaugh Personalized Weight Loss Care. Personalized weight loss, which is done in Charlottesville, Virginia. She runs this clinic as an in-person and also through telemedicine. How does she do this? She does this with a warm support approach. She empowers her individuals with medicine, compounded with and adopted of an evidence-based obesity treatment. So she combines evidence-based along with our traditional medicine to help her wonderful clients and her patients, right? So today we're going to discuss the powerful role and mindset in weight loss. And we're going to also talk about health offerings and thoughts on how to shift your mind as you're going through this weight loss journey. Who am I bringing on to help you with this powerful, powerful mindset? It's the one and only Dr. Sarah Stombaugh. Woo! Alrighty, so as per usual, my handwriting used to be very, very, very excellent. But I have a wonderful doctor's handwriting, and sometimes I can't read my own handwriting. So I apologize for some of that blip within the intro. But we have Dr. Sarah Stombaugh here, and she's a wonderful, wonderful individual. I love her. She's really, 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 when we talk about that soft, encouraging approach, you guys will understand everything that I'm talking about as we enter into this wonderful conversation. So welcome, welcome, Dr. Sarah. How are you today?
Yes. Oh my gosh. Thank you so much. That was maybe the best introduction I have ever gotten in one of these. So I super, super appreciate that. I'm doing really well. Thank you so much. I'm excited to be here with you and your audience.
Oh, love, love, love it. Alrighty. So, we're excited about going into the journey, but as per usual, I really want my audience to get to know all of our guests. So let's bring them back as to what made you decide that you wanted to be a doctor in the first place. Bring them back to that part of your journey.
Absolutely. So I have always loved science, always really loved, particularly chemistry. I was actually a chemistry major in undergraduate. And I, from a young age, actually planned to be a pharmacist. And so I
Me too.
remember being, oh, really?
Yes.
I remember being in middle school, and my dad had cut out this article in Forbes magazine that was talking about pharmacy and how it was always going to be a very stable career. And I was like, that's great. I love science. I want a stable career. And so I just sort of had in my mind that I would be a pharmacist, really
Mhm.
not fully understanding what that meant. And so going into undergraduate, that was my plan. Actually, I came in pre-pharmacy, but as you know, probably quite well, pre-pharmacy,
Mhm.
pre-med are actually just the exact same thing. You're taking
Yes.
the same type of courses in order to prepare for either of those degrees. So I
Mhm.
worked in a CVS pharmacy for a couple of years as a pharmacy technician, and I hated it. I absolutely, I'd find myself reading the drug pamphlets. I was really interested in the medicine and how it worked and all of that. But the actual act of working in a retail pharmacy, I was like, oh no, I cannot do this. And so
Mhm.
I started to explore a lot of other areas in healthcare, really enjoying interacting with people, really enjoying that science aspect. I thought about a lot of things, physical therapy, dentistry, all of it, and landed on medicine. And so I went to medical school and the rest is history.
The rest is history. Okay, I love it. All right, so we do have the parallels with both of us wanting to be pharmacists because that was me too in high school. I'm like, oh yeah, I could be a pharmacist. And what drew me away from that was similar to you, where I wanted more interaction with
Hmm.
the patient in a different setting. And so I love that you took the time, just as a lot of us, in trying to explore that part of the curiosity that you had, because had you not, you would have said like, oh, I'm going to be a pharmacist, just taking classes but not exploring and seeing exactly what pharmacists do, what are part of their day to day. Of course, that's still just a limited view, right? Because all you got the limited view of the retail pharmacy. I got the
Hmm.
limited view of the hospital pharmacy that
True.
where they didn't know what to do with a high school student, so they put me in the basement to correlate. So I was like, no. But needless
Yeah.
to say, we both realized that we're a people person and that we wanted to interact and to be able to, explore and zone in on a different portion of the healthcare system. So I'm glad that you did medicine. Alrighty, so now here you are in medical school.
Hmm.
What made you decide to do family medicine? Because there are so many different aspects of medicine.
Hmm.
Yeah,
Yeah,
so
I was
tell us.
actually being drawn into medicine. A big interest of mine from the very beginning was the obesity medicine piece. And so,
Mm,
even part of the decision to do family medicine was actually rooted in that. So, our family, I grew up in a really rural, small town area. A lot of family members have struggled with significant obesity. I saw a lot of obesity, and I had always sort of wondered why, what was it
mhm,
that drove people to that? And it was a big factor in deciding to about a specialty. Back at that time, it was called bariatric medicine. And
mhm.
I had been doing an internet search late one night. And like, how can I loved, I'm a chemistry major in undergraduate, particularly biochemistry. I loved food science. My backup plan was to do a ConAgra is based in Omaha, Nebraska, or at least was at that time. They've moved headquarters, but it was based in Omaha, Nebraska, which is where I went to both undergraduate at Creighton University, and then I stayed there for medical school. And so
Mhm.
I'd had this interest in food science, wanted to be able to support people in learning how to choose foods that would really fuel their body, and then understanding our metabolic health really. And so
Mm,
that was a big driver in choosing primary care. And then I'll say I was a little bit let down in that I didn't really get as much information as I wanted. And so as I was in primary care, finding that weight was often the root issue behind other conditions like high blood pressure or prediabetes or even cancers or heart disease that can be a correlated thing. And so I wanted to be able to support my patients better. And so all of the family medicine and then even that transition, and I wouldn't even say transition because in doing family medicine, obesity medicine was part of my residency training. I used all of my elective time in
mhm.
order to study that. And I came out of residency, sat right away for my family medicine boards, as you have to do, and then a few months later, sat for the obesity medicine boards.
Nice, nice, nice. So you already went into medicine having this passion for changing this part, right? Changing this portion of medicine where we are learning about a lot of the science of medicine. However, even exploring the metabolic health and exploring the depths of how food is affecting us, affecting not just weight, but affecting additional parts of our being, right? So food, its interaction with the cancers, interaction with even mental health. There's so many aspects of it. So you went in already with this broad view, and a lot of it came and it stemmed from what you saw around you, which is family, which
Mm-hmm.
inspires a lot of us, right? Why is this happening in my family? How can I support my family and other families who might be dealing with similar issues? So that plus your love for chemistry put you into an area where there was food science, and then now tapping into that and the bariatric medicine, which is now changed into obesity medicine, at least that portion for more learning and training. So you did that. So
Mhm.
now we are at this portion where you're now able to use all that you have learned, all these beautiful facets of medicine, your science, your biochemistry, your training in obesity medicine, and training in just being a primary care physician. And now you've tapped in all of that into opening your own practice. How
Mhm.
did that come along?
Yeah, absolutely. Well, I practiced in primary care in the Chicagoland area for a few years before we moved to Virginia. My husband is also a physician, and his training was quite a bit longer, mostly because he did two fellowships. So he finished a longer residency and then did two fellowships thereafter. And so
Mhm.
I had gotten a job as a employed family medicine physician in the Chicagoland area. And in that job, I did sort of unofficially then practice medical weight loss with my patients. And then other physicians in the practice would refer their patients to me, and I would help support them in their weight loss goals as well. And so I practiced in that capacity for a few years.
Mhm.
And there were aspects of it that I really enjoyed, but there were a lot of other challenges and frustrations. And when my husband he finished his training and had the opportunity to sort of go anywhere, we started looking at places that would really best support both of our career goals and our family goals. And I'm like, hey, this is as good a time as any to make the leap. And so it was with the move that I decided to open my private practice. And so I've been doing that. I'm coming up on 2 years in
Mhm.
January of 2025, will be 2 years in Charlottesville, Virginia, in my practice.
Oh, that is exciting. Exciting. Alrighty. So now here's the thing. As a part of your practice, you are able to help your clients with weight loss, but also help them to transform their mindset to prepare them for this journey of weight loss and to help them
Mhm.
throughout the journey. And today, you're going to be able to share with us like some of your top three. We might even be able to get some more, but we'll at
Mhm.
least start with the top three mindsets that you've been able to use, and your patients have been able to use to help them along this journey. I'm really excited that you're
Mhm.
sharing this with us. So go ahead, tell us what are some of the top mindsets that you've noticed.
Yes,
Mhm.
absolutely. I think one of the biggest things, we talked about sort of the science of our metabolic health and understanding that. And one of the things that was really interesting to me coming out of residency, having done my board certification, then also in obesity medicine, I started practicing doing all of this, putting this together for my patients. And I would devise meal plans with them. We would talk about macronutrients, we would talk about exercise, we would talk about all of these pieces. And one of the things that I found is it wasn't so much the knowledge of those things, it was
Mhm.
how to actually implement it.
Mm.
And that piece of understanding our mind, understanding what we do and why we do it is so, so much more valuable than just, you should eat X grams of protein or you should eat this many servings of vegetables. So that mindset piece is really like that's the magic sauce. Like if that piece isn't there, none of the rest of it will happen. Or if it does, it's not going to create sustainable weight loss. So I say that to preface the mindset piece is the crucial piece here. And I think there can
Mhm.
be a few things. I think some of my biggest messaging is learning to understand our body and reconnect with our body. And
Mhm.
so we look at children. If you have young kids, my kids are 2, 4, and 6. One of the things that is so fascinating to me is watching their eating behaviors and how they are just so in tune with what is their hunger, what is their satiety. And I was laughing the other day because my daughter was eating Ritz crackers. She'd eaten a few of them. And then she ate half of her last Ritz cracker, set it down, and was like, all done. And I was like, what do you mean you're all done? Who eats half of a Ritz cracker, right? Like, I don't remember the last time I didn't finish a Ritz cracker. It's half
Mhm.
of a Ritz cracker. You're just going to finish it. But kids are that
Mm.
in tune with their hunger, with their satiety. I think of like the kid was eating a cookie the other day and didn't finish the cookie. It was like, I'm full. And I'm like, what do you mean you're full? I didn't say that obviously, but
Yeah.
in my mind, like as an adult, I would finish the cookie, right? Like
Yes, because we feel
we
like there's like a waste portion, or you should. There's this.
exactly. Or it's like a single cookie, like that's a portion size. And so therefore, if that's the portion size, I'll finish it. So it's really interesting this reconnection with what is my
Mhm.
hunger, what is my satiety. And so there's a lot of factors with chronic excess weight that contribute to those signals being out of whack. But what we
Mhm.
can really start to pay attention to is what are the foods that are fueling that. So starting to pay attention to, okay, am I hungry right now? A lot of times we eat for reasons beyond hunger. We eat
Yes.
because the time on the clock tells us to, we eat because our work schedule tells us to, we eat because our family is sitting down to eat dinner. And not that we can't eat during those times because it may make sense to, but you may start a meal and recognize, okay, I'm not super hungry right now. I know it makes sense to eat because this is my break and I'm not going to have a chance for the next 6 hours.
Yes.
But do I maybe eat a slightly different portion, or am I more intentional about the type of food that I'm choosing to fuel my body, for example? And then at
Mhm.
the end of a meal as well, are we stopping to think about satiety? And is my body feeling satiated? Do I feel comfortable in my satiety versus have I overdone that? Even if just by a little bit. Sometimes
Mhm.
our food can start to add up in a way that at the end of a meal we feel like, oh, I probably could have done with a little bit less, for example. Or starting to feel like, oh, I wish I was, wearing sweatpants right now. There
Yeah.
are times where we overeat because we're maybe watching television, we're scrolling on our
Mhm.
cell phone, we're not really paying attention to food that we're eating. There's other times we've waited too long to eat and now we're over hungry, so we eat too quickly. And so,
Mhm.
really keying into what is our hunger and what is our fullness and how can we pay attention to those is really one of my favorite tools to support someone with in the beginning of their journey.
Yeah, absolutely. And I have found myself in all of those categories. So
Mhm.
even this week, while at work, for those who don't know, like I am emergency medicine and I've been working nights, what we call nocturnists, for the past almost 6 years. And one of the things that we're tapping into is mindful eating. And so this
Mhm.
week, I said, okay, I'm going to do some mindful eating. But the crazy thing about it is because of the erratic schedule and not having any set time to eat, number one, I'm eating in the middle of the night. My mindful eating is 2 a.m. in the morning.
Mhm.
So you can imagine. And not only is it that, but I'm doing that and trying my best to stay mindful and not look at charts, not say, okay, I can dispo this patient while I'm eating. So, am I really
Mhm.
paying attention to what I'm eating? Am I paying attention to if I'm full or not? I'm just like stuffing something down my mouth because I
Mhm.
know that I have 4 or 5 more hours, as you mentioned, right? And that's an allotted time I'm giving myself to eat so that I can have some type of mental energy for the next 4 hours in case a really, really crazy, like, emergency occurs, like during that time,
Mhm.
So you can see how that can pose its challenge when you're trying to be on a journey where you don't have that set time. You don't have, but
Mhm.
I still gave myself mindful eating. I gave myself 3 minutes. And it was good, but it's a start, right?
Mhm.
It's a start. So, as you mentioned, and what it did, and I'm pretty sure that this is what you'll talk to also, is it gave me a chance to slow down, which is the first
Mhm.
part, and to think about how am I feeling right now with the foods that I'm eating, and am I hungry or am I getting full, and really just savoring the meal versus just stuffing it down my throat, which is what
Mhm.
ends up happening. But go ahead, I'll let you talk about the rest.
Yeah, well, I think that piece is really important because we think about how we fuel our bodies. And
Hmm.
so the reality is food is fuel. The entire point of eating, at least from a survival standpoint, food can
Yes.
have a lot of other roles, and I don't want to minimize that. But the point of eating at its core is to provide fuel for our bodies. And so when we
Hmm.
think about the way different foods fuel our bodies, how do we feel after we've eaten certain foods? That piece is really, really valuable. And from a planning standpoint, we can tap into that and be really planful about the conversation that you and I are having right now when we're thinking,
Hmm.
we're using our prefrontal cortex, our developed human brain that's very logical, it's very planful. It allows us to make plans, many years in advance even, but certainly days or
Hmm.
hours in advance, versus when we found ourselves just sort of like ravenously hungry. I haven't planned ahead. I'm like, oh my gosh, I'm hungry. What am I
Whatever's
going to
around.
eat? Yeah, and like, especially in a hospital environment, I can't tell
Mhm.
you how many meals on call were fueled with like graham crackers and peanut butter,
And
which
peanut
is like
butter.
definitely a classic in the hospital. Um, yeah, like I would always have like graham crackers, the peanut butter, and milk, for example. And
Mhm.
so, how can we though? Because that is driven by like I'm hungry. I know I need to
Mhm.
eat something. And now my primitive brain is kicking in because your brain is going to make sure you don't starve. Your body is protective, right? It's not going to
Mhm.
allow you to starve. And now, though, you kind of turn into this like, oh my gosh, like I'm seeking food in just any way I can, rather than being that thoughtful, planful,
Mhm.
intentional self that you were desiring. And so I think being able to be really planful in advance, whether that looks like the morning of, the night before, over a
Mhm.
weekend, on a day off. It can look like different things for different people. But when
Absolutely.
we plan, it allows us to tap into that thinking, planning, logical brain, which is going to be more in line with our overall health goals.
Absolutely. Absolutely. You can see how putting into place just a little bit of planning, how it can help to offset. Because even if you are in that mode where you don't have that much time, but you've already
Mhm.
planned and brought in what you wanted to eat, you might not, if you're in a setting that's chaotic as the ER like mine, you might not have the opportunity to eat all of it, but you at least know what you're eating is nutritious and would be fuel for your body versus just a high crash, right? Which is what a lot of
Mhm.
us do in healthcare or in high stress environments. I don't know if anyone else who's listening in this has also been in high stress environments. You can let us know what's your go-to help. And you can be honest, because yes, the majority of the time when we don't plan, if we just think about what was the holiday season that just passed, it was what's that? Halloween.
Halloween.
Oh my
Yeah.
goodness. So
Mhm.
everyone brought in their kids' Halloween candy into the
Mhm.
ER in a drawer, and that was the fuel to get people throughout the night and throughout the day. When they can't eat, there's like stuffing. But we know the fact that if we are prepared, then we're more likely to say no thank you than we are to say
Mhm.
yes, give me some of that candy so I can get through, right? So that's definitely
Yeah.
good. That's
And it can
definitely
be good, it can be easy things too. I think
hmm
sometimes we have this idea that our food needs to be elaborately prepared and it needs to be like this beautifully served entree. And while that's great and wonderful and totally an option, I will offer to you, I wish I hadn't already eaten it because I'm going to like dig it out of the question.
I ate mine, but I can tell
But
you.
one of the things that which wasn't beautifully prepared, I literally a few minutes before we got on a call, I had a cheese stick, one of those little like avocado, like guacamole cups, and
hmm
then a apple with a little peanut butter packet. And like, not to make any favors for the environment, so I'm kind of embarrassed to admit that, because all of it was prepackaged stuff except for the
hmm
apple. But literally, cheese stick, I used the cheese stick to like dip guacamole and I ate that. It's really
hmm
good to
I'm gonna
combine
try
those two
that one.
things. And then put some peanut butter onto a apple. And like, those were just, I was running out the door to the office this morning and I was like, open the fridge, grab, 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 and go. And so it ends up
Mm,
having the same level of ease as grabbing a handful of candy. So I want to
absolutely.
offer that as well. Like, what is the lowest food to mouth barrier, as I like to call it?
I love that. Say that one again. It's a food to
Yeah,
mouth.
food to mouth barrier. Yeah, you want the lowest food to mouth barrier. Just easy to grab, easy to eat.
Easy to grab and easy to eat. All right. So we've gone over a couple of mindset. One is really, being intentional and understanding this journey. And then I love this food to mouth barrier, like quickly. What can we do really quickly? What are some other things that we could say that prepares one when they're on this journey? Because there are two parts to the journey too that I'd love for us to really talk to. So the first part of the journey is when you're preparing to start the journey. And then the
Mhm.
second part of the journey is when you've been on it for a while and you might end up in a little bit of a plateau phase, and it's
Sure.
just like wondering, well, I'm kind of bored with everything because
Mhm.
change is challenging. Like we
Yeah.
change, but we need. So let's speak to those two areas. I'm getting ready to start. I'm very anxious. I'm not sure. I've tried so many different times, and this is
Mhm.
my time again. Like, what would we say to those people who are, ready for that portion of the journey?
I think actually for both sets of the people, one thing
Hmm.
I think is really important to tap into is your underlying why.
Mm,
So, why is it that I want to do this? And getting very clear, sometimes we set goals that are pretty short term, and that can be okay. That can drive
mhm,
us for a period of time. And we also want to understand, like, what is that long term vision? And is that something that's actually important to me versus has someone else recommended that? So we all know, for example, if you go into the doctor and they say, hey, you could lose a couple of pounds, generally the response to that is not going to hit the same as if it's our own. We've started thinking about it. We've started thinking about maybe the way our body moves or certain medical conditions or being around for our family or friends or being able to participate in different activities that we haven't been able to do for a while. We can
mhm,
start focusing in on not why in general should I lose weight, not what are the benefits of weight loss, but what does it mean to me? Like, what is the value for me and why do I actually care about that? Really
mhm,
tapping into that piece, both for getting started so that you can remind yourself of that, but then also on those plateaus when it gets boring, when you hit a plateau and you're feeling frustrated, to come back and remind yourself of that really compelling why that you had.
mhm. Absolutely, absolutely. And you're right. The personalized why is a little deeper than the why that's given from the external factors, right? Yes, you
Mhm.
need to do this. The doctor told me that I need to lose some weight in order to bring my blood pressure down. Okay. But when you internalize that and you've heard that, but you now are looking around for the reason why I want to lose the weight. Yes, I've heard the doctor tell me that, but you might not connect with that. But you might connect with, wow, my pressure, if it's consistently high, I notice that I'm getting headaches. I notice that when my pressure spikes up, I am feeling this way. I recognize that so many members of my family have had bad outcomes when they didn't even realize their pressures were high until it was really bad, right? But I want to be here for X person in my life who means so much to me. I want to be here for me because I want this additional goal that I've really been looking forward to and I'm almost there. And so that internal factors of your why when it means more to you than when someone is just telling you can drive you a little bit more, which is what we're saying. My why, where I have two kids, so yes, I want to be able to leave them a legacy of being able to determine and eat healthier, so I now have to choose healthier meals. So yes, it's okay to indulge, but I want their baseline to be that I'm choosing fruits and vegetables. So yes, I now have to make sure that I am a bigger example to them. So that why is a little bit deeper that, hey, you need to lose 5 pounds. You're like, thank you so
Mhm.
much, doc. But my why is this legacy that I'm leaving. So that
Mhm.
definitely hits very, 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 very close to heart. So anything else that you have that you wanted to explore with us and to
Yeah.
offer to those who are listening?
I think starting to tap into our belief system as well. You were saying that in the context of your children. And I think
Mhm.
this piece, understanding beliefs that we don't even realize are impacting us as significantly as they are. So the idea of like finishing a meal, for example, or,
Yes.
you have to finish your meal before you have dessert, or if you're a guest at someone's house, you have to eat what they're serving. Whatever the belief system is, it's really fascinating to start to tap into that a little bit and
Mm,
realize that there are many beliefs that we have, like wasting food, you mentioned earlier. That is
yes.
such a common belief. Like if you don't finish your meal, then you're wasting food. So starting to tap into, is that belief actually serving me? How is it serving me? And if it's not, is there room to adjust that?
Mhm. Ah, that's such a powerful one. You're right. There are lots of customs that we have that we follow because they're customs, I
Hmm.
believe. where we, if we were to really tap into the deeper aspects of it, we might not even realize. I think that there's like a beautiful story about a gentleman, and he told a story about this lady that's making like a meatloaf, and she always like cut off this certain portion, like maybe like a half inch, and put it in a pan. And the kids asked like, why do you do that? And she's like, because that's what we do. And then she went back and then asked her mom, who taught her how to make this meatloaf. And the mom said, well, because the pan that we had at that time, it couldn't fit the entire thing, so we always just cut off that part. So she is, but now the pans are bigger. But we just did things. Why? Because we didn't have any understanding or reasoning. We just did it because that's how we were just taught, or we watched, and that was our belief that that's the way to do it. But when we tap
Mhm.
into the reason, then you realize like, wow, if we do tap into some of these reasons, there are changes that we can make, and it might not be changes that will be offensive, right?
Mhm.
Because her mom would not have been offended if the meatloaf was a little bit.
Sure.
It's just that we really do things a lot of times out of automaticity, and being intentional and asking and adjusting. Because even in my family, it's just like, eat all the food. Well,
Mhm.
sometimes, but like you said, like your daughter was full at half a
Yeah.
cracker. And our mind would say, well, why weren't you full at the cracker before that half a cracker? Because
Right.
the cracker before that half, I wasn't full, but now I'm full
Mhm.
at that halfway point. And it's okay to be full at the halfway point, and it's okay to stop, and it's
Yeah.
okay to honor our body and the, its natural satiety points that we're having. So I love it. Alrighty. So we've really put in a lot.
Yeah.
A lot of information into those who are listening. And so, what would you say to that person now who, they're just like so excited about this journey, but they're like, oh my gosh, Dr. Stombaugh, the holiday seasons are coming. Do you realize that in a couple weeks it's Thanksgiving, and then after that it's Christmas, and then it's New Year's, and then after that it's Valentine's Day, and then it's
Mhm.
Easter? Like, what would you say to
There's
that
always
person?
something. Yeah.
Absolutely. Yeah.
I think learning how to plan, and then planning includes intentionally enjoying foods that we really enjoy that are maybe less in line with our health goals. If we think about Thanksgiving, and if you imagine like a slice of pumpkin pie has like, I don't know, 250 calories in it. It's not like 250 calories has not made or broken anybody's dietary plan. But what happens is we build up these foods, we sort of put them on a pedestal. We say, I'm not going
Mm,
to eat sweets. And the reality is, if you are looking for a long term solution, being able to find yourself at peace with those foods and having freedom around those foods where you can enjoy them in a way that feels very intentional. And so, what I
mhm.
will often recommend is don't decide to have zero. If you say, maybe if it's a food you hate, fine, you can never have it again. But if it's your favorite food, if you love pumpkin pie, for example,
Mhm.
deciding that you're going to have zero is really like you're going to spend the entire Thanksgiving like, oh, poor me, or fighting
Yes.
yourself like, oh, I want it, but I said I wouldn't. Set a different goal. Set a goal of I'm going to have one slice of pumpkin pie, and when I eat it, I'm really going to enjoy it. And then
Absolutely.
you've had the slice, you've enjoyed the slice, you can be really intentional about it. If you think about the week of the holidays, maybe you're traveling or maybe you've got a bunch of parties, kind of step back and look globally. Over this 7 days, for example, I'd like to enjoy three desserts even. It does not have to be zero. It can be
Mhm.
three, and it can be three desserts that are enjoyed in a very intentional way, really sat down, consumed, and savored. And then when you're done, you don't have to beat yourself up about having had them because you did what you said you were going to do.
Absolutely. And I love that mindset going into these holiday seasons where you do not want to deprave yourself of, number one, food is a communal way, and we're social beings, and a lot of the times we really commune over food. So when we're having family together, you don't want to deprive yourself from being communing over the food. But if you set some intentional goals ahead of time, then you can enjoy that time with your family. You can enjoy the dessert, and you can just sit and really be at peace. Why? Because you've decided ahead of time, you've organized yourself ahead of time, and then now you can really sit and just enjoy the family setting without really going through your mind and just saying, oh my God, I ate a slice. I told myself I wasn't going to eat anything. There I go eating. I can't stop
Mhm.
myself. I can't stop myself. And then, when we get into that other portion, where we get into that mindset that we have felt, well, we're going to toss out everything because I already did so poorly. And then, we
Mhm.
start to beat ourselves up. So we really don't want to beat ourselves up. We really want to just be intentional and know that a part of this journey is that it's a journey and that it continues and
Mhm.
it flows and it's long term. It's so if it's something that you love, you're not going to deprive yourself of it forever. You just do it in a space where you can enjoy it. You set it and you've done it intentionally, and then you can move on.
Yeah,
Move
and if
on.
it's something you don't love, don't eat it, right? Like,
Don't
I
eat
think
it.
which,
Don't waste
like,
it. Don't.
yeah, this is where it comes, like, you're a guest and you feel like, "Oh, they've made it, I need to eat it." If you try a bite and you're like, it's not that good," like, you could stop. You could say, "I'm full. Oh my gosh, this was so good, but I can't eat anymore. Thank you so much. I really appreciate
Mhm.
it." But if you try something and you don't like it, you also have permission to stop.
You have permission to stop. I love it. I love it. Alrighty, now here we are in this part of the journey. Now, there's so many facets of life and of journey that all of us go on, and one of them that a lot of us have been on is this journey of burnout. Oh, MG. Have
Mhm.
you ever experienced burnout? And if so, what did it look like for you?
Yes. So a big part of why I am here today in private practice is because of burnout.
Hmm.
And I was an employed family medicine physician, and my job had actually been going quite well up until the pandemic, which I think is the story for a lot of physicians.
Hmm.
And we saw a lot of shifts in terms of staffing, especially, but then even just in terms of patient volume. Things had been a lot slower during the pandemic. I actually had my second child in June of 2020. And so the timing of that, I came back from maternity leave in September of 2020. And I felt like I came back to just a completely different job than I had left pre maternity leave. And it went from being what was already a pretty demanding, 15 to 20 patients per day,
Hmm.
very similar schedule. Now I was breastfeeding my baby, so I was trying to pump. Sometimes the slot would be double booked, but I still, I had these like pumping slots that I was trying to accommodate. So I was
Hmm.
working later in the evening because I needed to be able to like make up that income because we were paid basically based on our revenue that was brought in. We were paid a proportion of collections. And so it was okay. I was allowed to pump, and I wasn't penalized for it per se, but I would have had less revenue coming in. So I started working longer hours. We had a lot less
Mm.
staffing support because people had been either let go or decided to leave during the pandemic. And so we had a lot less triage staffing and that type of thing. And so my job became a lot more work, and especially work that was not necessarily at a physician level, often doing things that could have or should have been triaged by somebody else in the team. But doing a lot more work and finding myself having had a significantly decreased compensation for a variety of reasons related to the pandemic and maternity leave.
Mhm.
And it just felt like, oh my gosh, like I'm working so hard. I left for work every day at 7 a.m. I would get home at the earliest 5:30, 6 p.m., doing this Monday through Friday and half days on Saturday. And I'd stay late on
Ooh,
Wednesdays until 8. Oh, it was crazy. And
wow. So this is
I
6 days a
just,
week with a newborn
yeah,
and a toddler
yeah.
in
And
the
this is a
pandemic.
1.0 family medicine family medicine job, not residency, family medicine
Yeah.
outpatient job. And I it just became it was too much. And so it was through that actually that I found life coaching at all. And so I
Mhm,
started getting it for personal reasons to start figuring out, okay, what can I do to make my life better? I'm young, right? I'm in my mid 30s. And so
mhm.
figuring out like I'm pretty darn efficient on the computer, but can I get more efficient? I got a dragon and I started dictating. I started doing some charting efficiency things to be able to learn how I could close charts quickly or batch my work so I could move things. And I felt like I had really optimized the job as much as I really could. And
Mm-hmm.
it was just simply too much, especially
Mm.
with two young children at that time. Now we have three, especially with a husband who was still in training at that time, but
Yes.
even now has a demanding career. And so, really taking a step back to look at, okay, how can I continue to be a doctor? I don't want to leave medicine completely. I want to continue to function, but what I'm doing right now is not sustainable.
Mm.
And
Wow.
so here I am.
Wow. So really it was the opportunity to pull back the reins and to but of course in order to do that you had to really look at a bird's eye view. And number one, and
Mhm,
even if we talked about this whole thing about mindset, you also have to give yourself that opportunity to say, what is it that I want and what is my why? So all these questions that we really pose to our patients and our clients and those who, we're helping in this journey, these are questions that we had to pose to ourselves and
mhm,
ask ourselves also. And you recognize that there wasn't it wasn't feasible for you to work at that level,
mhm,
and you weren't happy, and also it wasn't where you would see yourself in the long run. Like, yes, I can do this for now, but for how long? Medicine, and it took a long time for us to get here. So the skill set that we've learned, we want to use them for as long as possible. And there's no
mhm,
way to do that at that capacity without running yourself ragged or even injuring yourself either mentally or physically. So
mhm.
I'm glad that you were able to step back and to now create, because right now you've created the life that you want. I mean, it's ever
Yes.
evolving, but it's the life that you want, right?
Mhm.
And then at the same time,
Exactly.
go ahead, tell us about it.
Yeah, no, I work a fairly fair full-time schedule, but I'll say our nanny works 39 hours per week. So I have
Mhm.
39 hours of childcare, and obviously there's work that I do that is clinical and work that I do that's more administrative and sort of CEO of my practice. But I do about 20 clinical hours per week, and those hours are busy and I'm, still growing the practice, but it's been amazing to be able to like go to the gym, and I start late on Mondays and take my daughter to an art and gym like mommy and me type class, and
Mhm.
on Wednesdays I work most of the day. I work from usually 7:30 in the morning till 2:30 in the afternoon, and then I pick my kids up from school. And so I've still worked a pretty decent day, but I have from 2:30 onwards with them. And so starting to, how can I both be a physician, be a mother, and balance these things, because you only have one life to live, and
Yes.
I was not enjoying the whole process. And there are so many challenges that come with being an entrepreneur, but I feel like there's so much more joy and excitement in having that empowerment to be able to make the decisions for myself.
Ah, so, 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 so wonderful. We have some people who are saying hello. I would have been remiss if I didn't say hi, Jessica. Hello,
Hi,
hello.
Jessica.
Thank you for watching. And then we have one of my lovely nurses. Hello, Kathy. She said, I love listening to both of you docs. Thank you. Thank you,
Oh.
Kathy. And thank you, Jessica. Alrighty. So now we're on to this fun question that I have asked all of my guests, all of my lovely guests. So, but here's the thing. I'm really slick. I've listened to
Mhm,
the conversation and I'll pull out things that you might have mentioned throughout this conversation that you can't use. So, if you
mhm.
weren't a doc, what would you be? And you can't be a pharmacist, which you already know that
Yeah, no, I don't want to be
you're not going
that.
to do that. Alrighty, so you can't be an obesity medicine doc doing nutrition. You can't do your food sciences back
Yeah,
in
okay.
Nebraska. And you can be an entrepreneur because you can do entrepreneurship for anything. But what would you
Yeah.
be if you weren't a doctor?
Yeah. So this is a skill set that is always evolving for me, but I'm pretty handy. I love
Mhm.
building things. I love like DIY type projects. And so I think something in the realm of that. I don't know interior designer would be a stretch in terms of what my current skill set is, but I would love to be
Mhm.
able to continue to grow that skill set. And I love, like putting things together and designing. I love color combinations and understanding those. And so something in the interior design, building, furniture refurbish type stuff. I think that would be
Ooh.
my career.
I love it. You're the first of my docs who would be refurbishing furniture, but Dr. Una is also going to be doing interior design. So you and Dr. Una will be
Oh,
the
all
interior
right.
design. Yes.
Mhm.
And a couple of our other docs will do interior decorating, but you definitely will help with the furniture. So we have so I have a utopia in my mind where all my
Yeah.
docs are part of my utopia. And that's why I asked this question. So I'm trying to figure out who's fitting in what portion. So you definitely are fitting in the decorative portions of the utopia. I'm
Mhm.
in the dancing portion where I'm a backup dancer, but really, really far back.
I
Um,
love it.
and then we also have some caterers. We have travel photographers. We have travel journalists. We have
So cool.
so many different people that are part of that. So I love that skill set. So I know where to drop off my furniture to get it refurbished. Love it, love it, love it. Alrighty, so with that, Dr. Stombaugh, we're going to end this wonderful conversation. But I want people to know there are so many people who are listening and who are watching on Facebook. They're on LinkedIn. This has also been streaming on Instagram. So if they are in the Virginia or the Illinois area, where you have board certification and you are able to take care of them, where can they find you? If you have some people
Yes.
who are in those areas and they're like, oh, I'd love to have a doc like her, I love her approach, I like the way she thinks about things, and I'd love to be part of her patient panel. Go ahead, tell us how we can
Yeah,
find you.
absolutely. So I see patients in person in Charlottesville, Virginia, and then, as you said, by telemedicine throughout the state of Illinois and Virginia, soon to be Tennessee. My Tennessee license has taken 100 years, but that is almost ready to go as well for telemedicine patients. And so for patients
Nice.
who are in those states, yeah, I'm really excited. You can visit www.sarahstombaughmd.com to learn more about my practice and to
Mhm.
enroll or schedule a free meet and greet visit. And then I try to be everywhere. I have a weekly podcast called Conquer Your Weight. I'm on Facebook, Instagram, TikTok. My YouTube is will be published soon. We have a channel that we are building right now, and I'm on a new platform called Good Self. So I am all over the place, also with a brand new GLP guide. So for
Mhm.
patients who are taking GLP medications to help support them in their journey, and they can find that on my website as well.
Oh, wonderful, wonderful. So, all things Dr. Sarah on sarahstombaugmd.com. You can find her on the different social media platforms. And as with a lot of our docs who are here on the Dr. Tamara Beckford show, they definitely are providing a lot of great high information for you. So, these are doctors who are out there on social media on TikTok, but you're getting doctor grade information.
Mhm.
Not just the latest trend out there. So don't hesitate to really connect, send messages, and follow her on these platforms so that you can learn different techniques on how to help with the mindset on the journey of weight loss and weight health and weight care, which is most importantly what we all about. Alrighty, well, thank you so much, Dr. Sarah. Any last minute words of wisdom for those who might be watching before we end this conversation?
I think for anybody who has been on a weight loss journey in the past and has had challenges, reaching out for support, particularly with a board certified obesity medicine physician, is a phenomenal tool. You can find a board certified obesity medicine physician on ABOM, the American Board of Obesity Medicine, and there's no shame in that. Our metabolic health and our weight are medical conditions that deserve support and comprehensive care, no different than anything else.
Absolutely. So there's no shame in getting help and support because that's part of our entire care, right? Weight care is part of your
Mhm.
health care, and have no shame if you've tried before and had not been successful. There are lots and lots and lots of different ways out there to help to support you. So Don't forget to connect with these wonderful doctors. I want to thank those of you who have been watching this wonderful journey and with this wonderful conversation with Dr. Sarah Stombaugh here on the Dr. Tamara Beckford Show. Now, I know some of you are just jumping on and you're like, oh my gosh, I didn't hear all of it. Have no fear. This wonderful conversation is going to be available on our Your Curing Docs website. That's URCaringDocs.com. You're going to see Dr. Stombaugh's beautiful face once you hit the podcast link, and you just connect with that and you're going to be able to get this wonderful conversation. Now, if those of you are looking for a doctor who is going to be helping you with the burnout, guess who it is? That's me. So all our women out there who are dealing with burnout, you're a high achieving woman, and you've noticed that burnout is really trying to take away your joy, your peace, and your sense of self, just connect with me. You can do so at yourcaringdocs.com. I have a wonderful program called Thrive Program. It's a lovely one-to-one coaching program where I help all our high achieving women who are going through burnout to help them to restore that joy, pain, and sense of peace and meaning back in their life. So I'd love to be able to support you on that journey. Connect with me. And with that, we're going to end today's wonderful conversation. Thank you so much, Dr. Sarah. Thank you, everyone who are watching. You guys have a great day. All right. Bye-bye.